I think I got it.
Okay.
Yep.
So welcome everybody. Uh, on your screen here, if you're on your computer, is Deb Simmons from Blue Cross Blue Shield of Illinois and Lori Warrens from our Bloman Ray. You guys have all pretty well seen Lori before. Um, so apologize for the mix up where we had to go from in person to all teams. We're going to do this meeting again on Monday night, so we can try and catch everybody that maybe couldn't make it tonight. Deb's going to go over the new plan. Um, some of you know, some of you don't know. We've added a third option to try and alleviate some challenges that got brought to our attention by some employees. Um, don't know if it'll be perfect for you, but at the end of the meeting, I'll show you the cost differentials between those three plans for your weekly, what you would take out of your check weekly. So you can see that. I'll send that out to everybody and we'll make it available. The PowerPoint I can send you copies of. And we've also got them printed out to hand out at the shop. So any questions, we'll make Lori and Deb's contact info available so you can ask specific questions if you have some, whether it be on cost of pharmacy or, doctors in network, out of network type things. So with that said, I would ask, since we got several people on the call, um, be considerate. If you need to mute yourself, go ahead and mute. If you got a question, feel free to, ask the question. But we'll go from there. So Deb, I'll turn it over to you.
Thank you, Jason. I appreciate it. As Jason said, my name is Deb Simmons. I'm with Blue Cross Blue Shield of Illinois. I live in St. Joe, Illinois, and so I am coming live from my house in St. Joe. But so that's why one of the things I like to tell people is, while Blue Cross sometimes seems like it's, a bigger elephant, a bigger plan than a regional smaller health plan, most of us, many of us, live locally. So, I'm right here in St. Joe and available as Lori is to answer questions, be here, and be the team for you guys and a resource. So I use this plan myself. I get it. I understand it. So I feel very ingrained in the community and this plan. So I've been selling it for a long time, along with many other employer groups in the community. So I like to share that with you so that you guys know that I get it and I understand it. So I'm very excited to be offering Blue Cross Blue Shield to Paul's Machine and Welding. It's been a long time coming. I'm really excited. So I like to say, welcome to the Blues, in a good way, not a bad way. I am supposed to tell you that because we are recording this call, that it is a recorded message, and you guys know that. So if anybody comes on with questions, just know that you are being recorded. And like Jason said, mute your lines. I think everybody has. So we appreciate that. If you have questions, I believe it's best to put them in the chat room. And then maybe Lori, if you would just kind of keep track of those, maybe you can type back responses if necessary, or we can save them till the end, and then we'll address any questions. Hopefully our presentation will give you enough information to answer those questions. I have a lot of slides here for you. I'm going to go through some of them pretty quick because I feel like I know most of the questions you guys will have, how to look up providers, how's this going to impact my pharmacy, where do I go to the doctor, and what are the benefit choices. So some of the other stuff I do want to just touch on. We are mailing you guys a Blue Cross Blue Shield customized open enrollment guide that we're going to be sending to Paul's Machine. So in addition to this presentation, copies of the SBCs, you'll also be getting this guide from Blue Cross Blue Shield. I believe Jason also has it electronically, so he can send it out that way for you as well. So having said all that, I'm going to go ahead and attempt to share my content and see if this works. Let me see. Can you guys see the presentation now?
Yep.
Great.
Yeah.
Okay. All right. Awesome. I love it. So I know this was not an easy decision for the crew at Paul's Machine to make that transition to Blue Cross. So many things that went into the decision-making process of leaving your current plan that you guys had for many years to this larger national plan, Blue Cross Blue Shield of Illinois. So I guess I'd like to say is one, as I said, thank you, but two, why did they make the change? Not only one of the most important factors, obviously, is price. They're very cost conscious and aware of the increasing costs of your current plan, making it affordable while still giving you really good benefits. So giving you options, which I'm pleased to let you know that they've opted for 3 different plan designs to share with you guys and let you pick which plan you feel like is best for you based on what you spend out of your pocket for the premium and what you spend out of your pocket for the services when you seek services. So I used to be a regional health plan person, and when I left a regional health plan and went to Blue Cross Blue Shield of Illinois, and I switched to this plan. So, like I said, I use it. I believe in the value of the doctors in the hospital. So, what Blue Cross brings to the table is a national network, so that you will have access to not only local regional providers but also national providers. Our customer service, a lot of technology tools and resources that we'll have for you. Coverage is everywhere you go. So, and we'll talk a little bit about that. And I share the tools that we have with you. We have a lot of health and wellness programs, and again, the digital capabilities. So, what do you guys need to do as employees? Right now, you are in your open enrollment period. So, what you really need to do is pick the best plan that works for you and your family. So it's really important to really analyze the benefits, choose what you think is the best fit for you, and then get your enrollment information to Jason as soon as possible. Jason, I don't know what your deadline is. I'm sure you've shared that with them, but the sooner you can get the information to them, the sooner they can get it to us, and we can do our job to get everything and get you guys loaded. Given the holidays, Christmas is this weekend, we've got New Year's Eve. So we've got a lot of work to do in a short amount of time. So I just want to let you know, do not panic. Do not worry that you will not have coverage. We're going to put a couple things into place as stopgap measures for you while we work on getting your ID cards and those types of things for you. So get your enrollment information to Jason as quickly as possible. If you take regular routine maintenance meds, and if you can, go ahead and get a refill before the end of the year so you have some on hand while we work to get you set up within the Blue Cross system. Look for your new ID cards in the mail. We will be communicating with Lori and Jason between now and the end of the year as far as the process and where you're at in the process. So do we have you enrolled? So we'll keep you updated on that. So once you know that we have you loaded in the system, and we'll be sharing information with Jason, that be on the lookout for a generic white envelope in the mail, and don't throw it away thinking it's a credit card offer, because that will be your new Blue Cross Blue Shield ID card. We do not put the Blue Cross logo on our communications to our members. So just to give you a heads up and let you know about that. Our ID cards are issued with the employee's name only. We do not put your dependent's name on the ID cards. We've been doing it this way for 80 years, just to let you know, if you get the ID cards in the mail and it only has your employee and your spouse and your kids are on there, don't worry, don't think that they're not covered. They are covered. It's just the ID cards come with your name on them. If you need more ID cards, typically we only send out 2 in the mail. If you enroll as a family, you can copy the ID card, you can flip it over, call the 800 number on the back and request more. Or what I really would like to encourage you is to enroll in Blue Access for members, or BAM, if you will, where that gives you employees access to all of your benefits online. Then you can download the mobile app and then carry your ID card with you at all the times. When you go to the physician, as soon as, January 1 or after, make sure that you show the office your new ID card. Same for pharmacy, and we'll get in and talk a little bit about pharmacy. If you're taking a specialty medication, we're going to have new authorization from your physician once you get your ID card and we get you active in the system, to make sure that we get it sent to Blue Cross and our specialty pharmacy. And then again, we're going to talk a lot more about the pharmacy benefits as we get into this. So this is what your card's going to look like. Down in the bottom right corner, I like to show this PPO and RX. This just means if you enroll in the PPO plan and the HSA, basically, that you have nationwide coverage wherever you go with your medical and your pharmacy. Okay, here's the most important part is what we've put together for you is a benefit comparison of your current plan options. So in the green on the left side of the screen is your Health Alliance plan. So you have option 1 and option 2. So you could be enrolled in that option 1, which while it looks like it's a $0 deductible, it does have high dollar copays, for example, inpatient hospitalization of $1,500. And then 70% coverage where your plan pays 70%, you pay 30%. So if you're looking at option 1, if you're looking for something comparable, you would go to Blue Cross option 2, which is in the middle of the blues on the right section, and look at something similar to that. And I'm going to get into each one of our plans here in detail for you. If you are enrolled in the Health Alliance option 2, which is the $4,000 deductible, good news is that $4,000 has gone away, and we now have two $2,500 deductible plans for you. So let's dig into these first. So option 1 with Blue Cross Blue Shield, option 1 in the light blue, this says it's a select network and it's an HSA. It's a health savings account. That means it's a qualified high deductible health plan where after the deductible is met, the plan kicks in at 100%. So if you look at this benefit, you'll see the individual deductible $2,500. If you're a family, it's $5,000. So let's just say Deb Simmons, I'm enrolled by myself. I go to the doctor on January 1. They're going to ask for payment in full from me until I have spent $2,500 out of my pocket for benefits. Once I have met that $2,500, this is pretty magical. Everything pays then the rest of the year at 100%. I am currently enrolled in an HSA plan myself. Unfortunately, my deductible is $5,000, but once I hit my $5,000 deductible, and actually we have 2 weeks left in the end of the year. If you talk to any providers' offices right now, they'll let you know that there's an influx in services and requests because a lot of people have met their deductible or out-of-pocket max, and they're wanting to get services in before the end of the year because they've already hit that amount. So this is a nice plan. But what we want people to be aware of, if you take a high dollar drug, a prescription, and January 1, when you go in to get that prescription filled, until you meet your deductible and out-of-pocket max, you'll have to pay 100% of that prescription drug. So the medical and the pharmacy all rolls up into that deductible and out-of-pocket max bucket. So you could look at this as if it's good or bad in the fact that one, you either don't use a lot of benefits, and so it's probably the lowest cost option for you. And Jason, I can't speak to what the premium is as far as the charges for each employee, and you guys can talk about that. But this is a really nice plan. I like this plan. I have this plan. I just know on January 1 that I need to have money in my health savings account so that I could pay for out-of-pocket expenses up to that $2,500. One thing you will notice in all three of the Blue Cross plans that are offered, wellness benefits are paid at 100%, no deductible. That means if I go in and take my annual physical, routine exam, blood work, mammogram, colonoscopy, those types of things, that service is paid at 100% for me once a year. So that is the same no matter which plan you select. Okay, so I'm going to jump then into option number 2, which is, and I'm going to talk about the networks here in a little bit, but this plan, option number 2, is very similar to a traditional copay plan. So better deductible, or the same as option number 1, or better than option number 2 for Health Alliance. This plan has a $1,500 individual deductible. So again, Deb Simmons is enrolled in this plan. My deductible is $1,500. However, it has copays. So if you'll see here for primary care office visit, it's a $30 copay. If I go see a specialist, it's a $50 copay. I do not have to meet that $1,500 deductible first. I would just pay my $30 copay for see my primary care, Dr. Walker at Christie Clinic. It's a $30 copay, no deductible, and everything else is covered at 100% for you. Specialist, Oncologists, neurologists, cardiologists, those types of physicians, they are the $50 copay. Again, no deductible. I really like to point out a couple things. One, your emergency room benefit is a flat dollar copay. With your previous two plans, it was a $250 or $200 copay for emergency room. On this plan, it's a $150 copay for ER. But if you look at the line right above that, you'll see urgent care. And we'll get into locations and what's available as far as urgent care facilities. But if you go to the an urgent care walk-in clinic, which is OSF Ergo or Christie Clinics, Convenient Care, those type of services are an office visit copay. So not only did you save yourself 5 hours and a little bit of money out of your pocket, it's a lot quicker, and you can usually get in and out with that office visit copay. So that's a nice benefit for you. You'll see again on this plan, the wellness benefit is 100%. All other services after your deductible is 80%. If you look at option 1 for Health Alliance, remember that one was 70% benefit, where this one is 80%. So it's a little bit better for you. Let's see. So inpatient hospitalization, it's your deductible first, and then the benefit will pay at 80%. You as the employee would pay 20%. That's inpatient hospitalization, imaging, CT scans, MRIs, those type of services, again, is deductible and coinsurance, and outpatient surgery is the same. It's deductible and then that 80%. So prescription drugs, you can see that I've outlined the Health Alliance prescription drug copays, and they have 6 tiers. We also have 6 tiers, and I'm going to break it down on the next slide for you and get into a little more detail. Blue Cross has what we call preferred pharmacies, and like tier 1, and then tier 2 pharmacies, and then out-of-network pharmacies. So you can see the double copay for pharmacy is $0 for generic, $10 for a generic but in-network, and then so on. So you can see the differences of the copays for this plan here in the middle. The third option that Jason and the team wanted to offer you is a $2,500 deductible plan. $2,500 deductible, and then your out-of-pocket max for an individual is $4,500. The coinsurance on this plan is the same as option 2, so it's 80% again, and this plan has copays where you do not have to meet your deductible first. The difference in this co-plan is that office visit for primary care and specialist is the same. So it's a $30 copay no matter what type of provider that you see. The emergency room on this plan is $250 copay, and your urgent care is that $30 copay. And then you can see the benefits, the pharmacy benefits down at the bottom. They're a little bit different than option 2, but you can see that there's still a good differential between the preferred pharmacy and out-of-network pharmacy. And again, I love that generic copay of $0. So what I'm going to talk about now is, if you look at the Blue Cross plans, at the top of the heading, it says Select Network, and then PPO Networked and Select Network. The Select Network that Blue Cross offers, it's a new network that we're rolling out, and it's a little bit more of a pared down network for you. Basically, what it means in Illinois is there's just a handful of providers up in the Chicagoland area that do not participate with the Select Network. But typically, or primarily, it's most all the providers in downstate are in the Blue Cross network and the Select Network. The middle option says it's our PPO network, which there are no holes in Chicago, and it really is a 100% access plan. All 3 of these plans allow seamless access to state Blue Cross providers, which means I was traveling last year for my daughter's wedding in Arizona. Something happened. I needed to go see urgent care facility. I pulled up the app on my phone, said, okay, providers, location, turn that on. Where can I go to see a Blue Cross provider, an urgent care facility? True story. And where can I go? Because I have a sinus infection and I need a script, right? So that's the beauty of actually all 3 of these plans, is that you would have access to Blue Cross's nationwide network of providers. The only difference is option 1 and option 3 is the Select Network. And again, there's just a handful of hospitals in the Chicago area that do not participate. Having said all that, I am going to go ahead and go down to the next slide and talk a little bit more about the prescription benefit and how it works for each one of the plans. So option 1, if you remember, it's the high deductible health plan where you have to meet your $2,500 deductible first, and then there's no charge for your prescription drugs after that deductible. So that's pretty user friendly. If you use one of Blue Cross's preferred pharmacies, obviously because we have a contract with them, you're going to get better pricing for those drugs versus going to a CVS or one that's out of the area. But again, $2,500 first, and then there's no charge for your prescriptions. Option number 2 and option number 3 have what we called a preferred pharmacy and non-preferred pharmacy. So if you go to one Blue Cross's preferred pharmacies, you'll get that generic drug at a zero copay versus a non-preferred pharmacy is $10. So what you're probably going to sit here and ask me now is like, okay, Deb, what's preferred pharmacy and what's not? So what we did is a search in your areas, and we found out that in Tier 1 for the preferred pharmacies, County Market, Family Drug in Shelbyville, Sam's Clubs, Save More, the Pharmacy Shop, Sullivan, Toledo, Villa Grove Pharmacy, Walgreens, and Walmart. Those are all Tier 1. So if you're Tier 1 and say you're enrolled in option 2, you can see if I take a generic and I'm at the preferred pharmacy, it's a $0 copay versus $10. What I do want to tell you though, Tier 3, which is CVS, is out of network. So Tier 1 and Tier 2, preferred and non-preferred, you can see the copays. But if you go to CVS, you're basically going to be paying full boat for that prescription drug. Tier 2 then, so our non-preferred pharmacies, which you still get, but at a little bit higher copay, is Dick's Pharmacy in Arthur, Meyer, Kramer Pharmacy, OSF, and so on. So you can see these different pharmacies are still in network, but it's a little bit different on the as far as the copay, depending on where you go. Again, I want to remind you, CVS is not contracted with Blue Cross, so you want to make sure that you steer clear from CVS, because if you do, it's going to be a lot more money out of your pocket. That's a mouthful. I've got a lot. I'm going to take a quick break. Does anybody have any questions before I keep going? Lori, is there anything?
I don't think so. I don't see any.
Great. Okay. So then the next slide talks a little bit about home delivery and prescriptions. We do have our own mail order service for any type of your mail order maintenance meds, and we use Accredo and or Prime Therapeutics. Your physician's office is very familiar with these, and they can work on getting those prescription drugs if it's specialty or needs prior authorization. So after January 1, your doctor would need to make sure that they send authorization to Blue Cross if it's already been authorized on Health Alliance, to make sure that Blue Cross gets that authorization for you. A couple things, you guys pretty much already know how PPO plans work, what are the advantages and disadvantages. Just make sure that you stay in network, because that's the best pricing and you're going to save the most amount of money. The health savings account, the HSA plan, employers do have the opportunity to set up a health savings account, or you as the member can set up a health savings account. You can go any one of your local banks and you can say that you have a high deductible health plan. You can set up a savings account where you can put in money throughout the course of the year, that you can use that tax deferred money to pay for unreimbursed medical expenses. In 2021, you can see that you can put away $3,600 in an account that you can use for unreimbursed medical, and that's going up to I'm sorry, did I say 3,600? Yeah, and it's going up to 3,650 for a single, and a family for 2022, you can see it's going to be 7,300. So just a little information about health savings accounts. So one of the biggest questions we're probably going to have is providers and where do I go to the doctor? What I like to do is break it into 3 buckets and talk about hospital, physicians, and then urgent care facilities. So locally, Blue Cross contracts with Carl, OSF. In Mattoon, we have Sarah Bush. In Shelbyville, we have HSHS. In Decatur, we have both St. Mary's and DMH, and we have Pana Community in Pana area. In surrounding areas, if you go to Decatur, Springfield, Bloomington, we pretty much have all of those hospitals in the area. The only one that is not participating in the Select Network product is Paris Community Hospital. So make sure you're aware of that. And again, national network is Barnes, Mayo Clinic, Cleveland Clinic, and so on. So those are the hospitals that participate with Blue Cross Blue Shield. And again, the only one that I could see is not in network downstate for that select network is Paris Community Hospital. Now let's talk about physician, because this is probably sometimes can be the most confusing. So what I like to say, we have Christie Clinic, and all of the docs at Christie Clinic in Blue Cross. And actually, I was in Bloomington today, and I didn't know that there's a new Christie Clinic office over there. So Christie Clinic is really expanding. For Carl, what I'll say about Carl is that years ago, maybe 5 or 6 years ago, Carl did not participate with Blue Cross Blue Shield. They did not want to be in our network. So we have been able to overcome that hurdle, but there's still a couple exclusions that they exclude some providers with the Blue Cross Blue Shield network. Primary care physicians, again, adult med, general internists, family practice, or pediatrics, Carl has said that they do not contract with Blue Cross Blue Shield in Champaign-Urbana and Mahomet. However, they do contract primary care in Danville, Hoopeston, Arcola, Paris, Rantoul, Mattoon, and so on. We have all of the specialists with Carl, whether it be in Champaign-Urbana and Mahomet or all of the rural areas. So really, if you look at the big picture of Carl, they are only excluding primary care docs at the main clinics in Champaign and in Mahomet. That does not include OBGYN. So if you're seeing an OBGYN in Champaign-Urbana, Mahomet, they are still considered in network with Blue Cross. So if you're seeing a primary care physician in Champaign-Urbana and Mahomet with your current plan, you would have to make the transition to an OSF or Christie primary care physician for it to be considered in network. Okay. I think any questions on that before I move on?
Was that just for the two plans that were select network? And then the other plan is all of the above?
Good question. So no, this physician contracting is the same, whether it be the select network or if it's the traditional PPO network. So either plan that you would pick locally, you would not have access to those primary care in Champaign-Urbana and Mahomet. So you would have to select one at Christie or OSF. So it does not affect or make a difference between which one of those plans you pick. Okay. Good question. The next slide touches on urgent care facilities. So Christie Clinic offers multiple different locations for their urgent care facilities, which you can go to any one of those and take advantage of that $30 copay versus the ER copay. OSF has Ergo locations. I think they call them on-call now, OSF on-call, but they have several locations in Champaign, and also they just opened a new one in Mattoon. There's also one in Danville too, I believe. Sarah Bush has a walk-in clinic in Mattoon, and I believe Carl has a walk-in clinic in Mattoon also. So these are the locations or the addresses for each one of those. And remember, I just want to remind you, in Champaign-Urbana, they have urgent care, or Carl has urgent care facilities in Champaign-Urbana. I don't think they have one in Mattoon. If you go to one of those, they're staffed by primary care physician. It would be paid out of network. If you go to a Carl urgent care in Danville or Tuscola or one of the other locations, because it's staffed by PCP who's in the network, it'd be covered in network. So I just want to advise you, don't go to a Carl urgent care convenience center in Champaign-Urbana and Mahomet because it won't be covered. You have to use one of these other ones. Take a break and see if there's any questions.
Yeah, I've got a question. This is Ben Rund. Is there like an app or something where you can go, pick a place and know what you're getting into? Because it seems a little,
yeah,
you don't exactly know what you're getting into. I didn't know if there's, I can go here and here's what my copays are and that kind of thing.
Yes, there is. So once we get you set up with Blue Cross and into the system, you can look at the screen right now and it says Blue Access for members. What we encourage you to do is get your ID card. You have your group number and your unique member ID, and register. So go to bcbsil.com and register as a new member. And once you get set up, then you can download the mobile app. Then you can carry all of that information with you, and it's specific to you. So you'll have your deductible, your copays, and your network. So you would have access. So you can see that you would know how much you've spent of your deductible, and then you can find care. So you could say, okay, Ben, you're enrolled in the plan, and depending on which plan you select, it'll say, okay, I want to look within a 25-mile radius, or wherever you want to search, that it would tell you exactly what providers you have access to. If you want to do that before you get enrolled in the plan, if you want to search providers before you get enrolled, you can go to bcbsil.com and you can search as a guest. And then you would just need to select a pop down that shows whether you're going to looking for the PPO network or a select network for doing searches before you get enrolled into the plan. Does that help?
Yeah, I think so. I maybe I missed that earlier. I came in a little bit late, so.
That's okay. Nope. No, actually, I was just getting ready to dig into that. I hadn't gotten there yet, but I'll talk really quickly about virtual visits. That's really due to COVID. Virtual visits have become very, very popular. There's two different ways you can do virtual visits. Once you log on to Blue Cross Blue Shield, the BAM, Blue Access for Members, you could register. So I'm not feeling well right now. I can go to my Blue Cross portal and say, I need to talk to someone right now. I don't want to get on my car. I don't want to go to urgent care. I want to see someone now. I can log on to Blue Access for Members and say, I want to speak to someone right now. You get into the queue, and then one of Blue Cross's providers will pop up, and I can have a session with that provider real time, and it's a $30 office visit copay. You could also have a televisit with your provider if they schedule it, and that's also an office visit copay. Those are different. So I go see Dr. Walker, and he goes, okay, I need to see you in 2 weeks. Do you want to come in, or do you want to do it over the phone? I'm like, oh, I don't want to come, just I want to do it over the phone. Again, that's an office visit, but that's different. That's initiated by my doctor, not me. The MD Live or virtual visit is initiated by the member, and you have to go through Blue Access for Members to gain access to that service. Again, this is the BAM or the Blue Access for Members portal where you can go on and register. And then there's so many different tools that are available. We talked about the mobile app, how you do that. What I can do on the Blue Access for Members, I can check my claims. Has something been paid? I can get an EOB. I can check my coverage, my pharmacy, my dependent information, and so on. There's so many different things that are available for me on that tool. Again, the provider finder, and then we have a lot of consumer tools, wellness, Blue Points, health risk assessments. We have gym membership programs, a lot of other tools that are available just by being a Blue Cross Blue Shield member. And then you can go look into all of those services and tools that are available once you get registered for the portal and the tool. Okay, that's my that's all the benefits that I have to talk to you about. So I just wanted to open it up and see if there are any questions about any of the plans, how they work, where you should go.
So I have a quick question. So suppose we select the no deductible plan, the option number 1. What's that going to look like? So when I go for a normal office visit, am I going to pay right there when I check in? They're going to bill me for whatever they think, the basic office visit's going to be. And if it gets into something more, then they bill the rest, or how does that work?
Yep, good question. So I'll use Christie Clinic as an example. So I go January 1 and I'm on this plan. My deductible is $2,500. So when I go see Dr. Walker for a routine office visit, the average charge is about $160. So they usually will not bill me or at that time of service. I will see Dr. Walker, I'll just use him as an example. I'll go see Dr. Walker. It's a $160 office visit. Then Christie Clinic will bill me. And what they will do is they will apply Blue Cross's discount. So the arrangement we have in place with Christie Clinic and those providers, they'll discount it, and then I will get a bill. I'll get an explanation of benefits and a bill for the portion that I owe. So let's say they charge $200, Blue Cross's discount gets it down to $150. I'm responsible for that $150 until I have spent $2,500 of my own money before the plan would then pay it 100%. If I
Okay,
have,
but I think
go ahead.
I think you answered my question there. So in most cases, the payment would not be due right there at the time of service. It would be billed.
Right. Correct. Yeah.
Right.
Okay.
Sometimes if I have an office as a copay, and I don't know about Carl, I can't speak for them. I don't think they ask for the money up front. Usually they'll just, if it's a copay, they'll say, do you have a copay and do you want to pay? So if I'm on option number 2 and I still go see my primary care physician, they'll say, do you want to pay your copay? So they would ask for that $30 up front. I believe they will also bill you for that $30. So they would do the same thing. Again, they would still send the bill to Blue Cross, and then you would be charged for your portion of that visit, which would be a $30 copay, depending on which plan you enroll in. Really good question, though. So let me talk really quick. If someone were to travel out of the area, let's go back to my Scottsdale, Arizona example. So if I went to a provider in Scottsdale, but I'm insured through Blue Cross, I show them my Blue Cross Blue Shield ID card. They would get the bill, they would get the claim, they would discount it based on Blue Cross's discounts because we have nationwide contracts with that discount. So in Arizona, they would discount it for Blue Cross, send it to Illinois, and Illinois would pay it based on what plan you are enrolled in. So it's pretty seamless. You don't have to do anything. Blue Cross handles it all. And then if it were a $30 copay, or if you're enrolled in option 1, you would pay the discounted amount of what that charge was when you went to that provider in Arizona.
This is Dan Garman. Did you just say when I go to the doctor now at Christie Clinic most of the time, when there's a copay, now they expect me to pay that copay right now. Are you telling me it won't be that way with Blue Cross Blue Shield?
No, your carrier, your health plan does not dictate whether or not Christie Clinic charges a copay. So if you are picking option number 2, where it's a $30 copay, they will still ask you for that copay. Usually, if you're with this option 1 with a $2,500 deductible, they typically won't ask you for that office visit amount because they need to submit it to us and then us discount it, so then we would know exactly how much you owe. So they would probably still collect the copay, but I can't speak on behalf of Christie Clinic or Carl. I mean, Laura, you might know, but if they're asking you for a copay now, they'll probably ask you for a copay going forward. Switching your health insurance carrier will not change that.
So that was option 1 where you were saying they're not going to ask for full payment whenever you go in for that visit.
I'm sorry, I missed the first part of his question.
Yeah, that's right, Dan. They're not going to ask for full payment right there at the time of service. You'll get billed for it.
With option 1.
Yes.
Right.
With option 1.
Yes.
Thank you.
Yep.
Deb, can you speak to one of the conversations that I had this afternoon with some people was understanding the individual deductible and the family deductible. So from the standpoint of an individual deductible of $2,500, if you're on a family plan, so you've got employee and spouse, employee and children, or employee or family,
Mm-hmm.
is the 2,500 on a per individual basis. So does the first, say the employee hits 2,500, if is it the 2,500 and then they are covered 100% and then you work up to the 5,000, or is it
Yes.
5,000 for the plan?
Yes. So what you said is correct. So it's a $2,500, and then you could work up to the 5,000.
So in other words, if I had my family on the plan and I got hospitalized and boom, right out of the gate, I've got a $2,500 bill. The rest of the year, anything that pertains to me individually would be covered 100% if I'm in option one.
That's a good question.
I wouldn't pay anything for, my medicine, or if I had to go in the hospital again or anything like that, I would be covered 100%. But my family would then have to make up the other 2,500 that is the out of pocket deductible for the family, correct?
Okay, so I just pulled up our SBC. So on this plan, the $2,500, oops, this is the wrong one. Hold on. Bear with me a second. Okay, this is my HSA. So on this plan, Jason, the $2,500 individual deductible. So this says you must pay all the costs for providers up to the deductible amount before this plan begins to pay. If you have other family members on the policy, the overall family deductible must be met before the plan begins to pay. So Jason, if you are enrolled as your family, then you would have to hit your family, you guys would have to hit the $5,000 before the plan would pay at 100%.
Okay, I think that's a good, a good distinction to say. So the 2120, the main plan,
Right.
if it's more than one individual, then it is 5,000 for the entire
Yes.
group, not an individual.
Yes.
Okay.
Yep.
Now, what about the alternative plan, the 2120?
Okay. On the 2120, which is the $2,500 deductible, and then the out-of-pocket max is $4,500. So you must pay all the costs from the providers up to the deductible, which is $2,500, before the plan would begin to pay. If you have other family members on the plan, each family member must meet their own deductible until the total amount of the deductible expenses are paid by the family.
So in that situation, it would be an individual 2,500
Yes.
per family member until you hit in that case, the 7,500 out of pocket.
That's right.
But that situation would be if I get the scenario that I laid out, if I go into the hospital, I hit my 2,500, then the rest of the year from my expenses, I would be covered.
Correct. So Jason, if you and Susan, and then you have kids, so if you hit your $2,500 for hospitalization, then your benefits would kick in then at the co-insurance after that. So this plan is 80%. So then you would start paying the 20% up until you hit your out-of-pocket maximum. Yeah, so this one's a little bit different than that HSA, where once you hit yours, then the plan starts paying. So each member has to hit their 2,500 until you hit that family amount of 7,500.
Okay. But each individual would theoretically hit their deductible, and then they would be just on the co-insurance until out-of-pocket max hits.
That's correct.
Okay.
Yep.
That was really good clarification question, Jason, especially on that option number one plan, because that was not what I had in my head there. So I'm glad you asked that question.
And I believe Lori and Jason have the SBCs, these detailed summaries. So that's a really good thing for you guys to have and to look at if you have questions about each one of these and how the deductible would work for an individual versus your family.
I've got another question if it's not hogging the floor too much here. It's maybe a little bit of a two-part question. The first one might be for Jason. For people that would choose option number one, Jason, have we talked about whether or not the company would sponsor a healthcare savings account? And when I say sponsor, I just mean just the administrative part of that for employees to put money away.
We can't do the HSA this year because we already have the FSA in place. So we will have to discuss that for next year, for 2023. How we want to handle that approach, considering these will be the same options we have. So we don't have that ability. If you're not in the FSA plan, the flex spending account plan with Paul's, you can go set up a HSA health savings account at your local bank. Multiple options. There's different places that can handle that for you. And then you can contribute. The difference will be, obviously, that would be after tax on a weekly basis or monthly basis, however you set it up. But then when you do your taxes at the end of the year, you'll be able to take that off of your taxable income. So
Right.
for this year, for 2022, the health savings account through Paul's is not an option. But Eddie and I've kind of talked about it. We'll visit that and see what what makes the most sense for the group going forward in 2023. So it could be an option, in 2 years, but just not this coming year.
Okay. And then the second part of my question, just because of my limited knowledge on how health savings accounts work, is it, with the flex plan, the money you put away, effectively, if you don't use that, you lose the money. Is a health savings account, is it truly a savings account in that, either you can roll the money over into the next year,
Yes.
or it's your money to use if you don't lose it, or I'm sorry, to use if you don't use it for healthcare expenses?
Yes,
Yes.
and I think that's what Deb's got up there to talk about.
Yep. So the HSA, I do like it because it is your money. It rolls with you year after year. So if you put money into the account the first year, you go to the bank and set it up, and you set money aside for your unreimbursed medical expenses. And if you don't use it, I know if you have you go to the doctor and it's a low copay and you have money in your pocket and you just want to go ahead and pay that, you can just pay the bill and leave the money in the savings account. It rolls over from year to year. If you were ever to leave Paul's, that money goes with you. Versus the flexible spending account, it has that use it or lose it type rule, where I do believe they have extended it and can roll over some of it. But when you allocate your money for health savings account, it continues to grow in that account and it is your money. So yes.
Yeah,
Okay,
this
thank
is,
you.
I've got a quick question. I have some specialists up at Carl, and you say they're all in network. Do I have
Yeah.
to have any kind of referrals to be able to use them, or can I just set up an appointment and be used? Do I have to be pre-approved to see them or anything like that?
That's a really good question. You do not have to referral. That's the great thing about this plan is that you can pick a specialist, and you're correct. Specialists in Champaign-Urbana or Mahomet are contracted with Blue Cross, so you don't have to be concerned that they would be paid out of network. So it is in network, and no, you do not have to have a referral. This plan is pretty much an open access. There's no what we call gatekeeper. So you would just make an appointment and just show your ID card the very first time when you go, so they know that they would need to bill Blue Cross instead of your previous plan.
Yeah. All right. Well, that answers the biggest question. Thank you.
Good. Mm-hmm.
Eddie
Go ahead.
said Eddie's got a question he
Yeah.
sent in through the chat. I don't know if you're getting ready to say that, Lori. Debbie says, I have kids that are enrolled in college out of state. Are there any differences if their primary care physician is out of state?
No, they would just want to make sure that they would want to use a Blue Cross Blue Shield provider in that state. So depending on what state they're in, they would want to you would go to bcbsil.com, and then when you go to search your area, then you would search whatever area that they're in, and it would show you what providers are in the Blue Cross network in that area. If you have a question about it too, you can just ask the doctor. Typically they know, and just say, hey, do you participate with Blue Cross Blue Shield? And they're like, yeah, nah, whatever. I will tell you that about 80 to 90% of all the providers in US participate with Blue Cross. So, the chances of them being in are pretty good. But you can just ask them too. Good question. Anything else? All right. Jason, I'll turn it back to you then.
Okay. Thanks, Deb. Guys, if if anybody does have questions that come up, tomorrow or next week, don't hesitate to call me, reach out via email. I'll get you in touch with Deb or Lori, and they can answer, all your questions with a little bit of research time. So don't hesitate. I know this is a big change and it's all kind of at the last minute here. Health Alliance kind of threw us a big curveball, so we had to scramble. So I'm going to share my screen now, and so I wanted to kind of give you a breakdown of what the costs for you would be for each of the plans that Deb laid out. So the main choice, the MIESA 2120 plan, that's the $2,500 deductible, max out
Hey,
of pocket
Jason.
20. Yeah, I'm sorry. Go ahead.
Jason, is there any way you can zoom in a little bit? That's pretty small on a phone screen.
Is it okay? Well, I can do my best there. If
That's good there. Yeah. Thank you.
okay.
My phone
Yep.
too.
And the other thing I would say, guys, I'll have this printed out. I can give it to you. I'll make sure everybody gets a copy of this. So, don't worry about not being able to see it right now if you can't. But this option, the first option that we talked about, the breakdown would be per week. The employee share would be $22.38. Right now, if you were on the main plan this year, 2021 with Health Alliance, you were paying $22.71. Okay. Now the main thing to think about with this plan is it's, you're going to pay from $0 through 2,500 or 5,000. You're going to be paying everything. Okay. But your weekly cost on an employee would be $22.38. On employee and spouse would be $57.29. Employee and children would be $57.71. And for the family, it would be $92.62. If you choose the alternative, what Deb has is alternative 3, or plan number 3, alternative 2, I believe is how she put it, where it's the $2,500 deductible. You've got copays for office visits. You've got copay for urgent care. You've got the $250 copay for ER, and you've got the tiered drugs. That plan breaks out at $31.71 per employee. Employee spouse would be at $78.26 a week. Employee and children would be $78.82, and family would be $125.37. So probably will need to do some calculating. Each person's individual situation is probably going to be different. In some cases, column, the first plan is going to be the better choice for total out of pocket. In some cases, column, this plan will be the best. The kind of the Cadillac plan, if you will, is this other plan, the 2080. That's got a $1,500 deductible, $4,500 family deductible, and it's got copays, co-insurance, the copays at urgent care, $150 ER, and the tiered drugs, as Deb said. The costs there are pretty substantial. They're at $55.07. It's comparable to where we were with the alternative plan for 2021 with Health Alliance. So that one was $57.55, $118.53, $111.38, $197. For the Blue Cross plan, it'll be $55.07, $130.75, $131.66, and $207.35. So again, I understand this is a significant increase in cost. We're all gonna deal with it. It's gonna make a change for everybody. So like I said, if you have questions that you want to ask in person, don't hesitate to call me. If you got specific questions about a certain drug or doctor, I can get you in touch with, if I can't get the answer, I'll get you in touch with Deb or Lori.
I got one quick question. I
Yeah,
think
go
we
ahead.
said it earlier. Preventatives were covered in all 3 of them, right? Like your yearly physical and colonoscopies and stuff like that was covered under all 3 plans, right?
Yes.
Yeah,
Okay.
that's 100% covered, Josh. Yep. One thing that's not in this discussion, and I don't have a slide to show you, but the dental plan The rate stayed the same for 2022. So if you have interest in getting dental, that's a voluntary plan. The employee pays the entire premium on that. Get with me and I'll get you the information. If you're in it now and you want to re-enroll, don't have to do anything. You'll just automatically re-enroll. So feel free to reach out to me on that as well. Any questions for me on the cost right now?
Jeff, you had your hand raised.
Yeah, this is Jeff Martin. I was wondering on the first plan, it's 0% after deductibles met. Is there any, if we use generic, like you had some tiers, if we use generic, is that free or you always pay whatever the drug costs?
That's a really good question. Sometimes if you get an antibiotic and you go to Meyer, they'll charge you $3 or $5. Or sometimes it's, like you said, it's free. If they do not submit it to the health plan, then usually with the $3 or the $5 copays, they typically don't submit those to the health plan. So you could just pay that copay and walk out the door. If anything else, like if it's $10 copay, they would submit it. If they submit it to the health plan, then it would go towards your deductible. But a lot of places will charge you $5 or $10, but they won't submit it to your health plan. And if that's arrangement between that pharmacy, a lot of times the big box stores, Walmart, and Meyer will do that to encourage you to go to the store and just say, hey, I'm going to give you this antibiotic for $5 copay, and then they don't submit it to the plan.
Thank you.
Mm-hmm.
For the insurance cards, it said we were supposed to get them by the 1st. How certain is that with shipping and all that mess?
Right. So I'll just be honest and say we're probably not going to have the actual ID card to you before the 1st. What our goal is, when we get you enrolled, my fingers are crossed that we'll get you enrolled and into the Blue Cross system before the 1st. Once that happens, then we will create a temporary ID card, 8.5 by 11 piece of paper with your account number, 800 numbers, and we will get that out to you as soon as possible. So you will have something in your hand before your ID cards get to you. Once you get that temporary ID card, and if you want to go online and register with your app, you can do that as well. But we'll be working with Lori and Jason. Jason, I don't know if you're in the office, but you're going to be on standby so we can get this stuff out to you guys.
Yep, I'm in there all next week, so we'll get her put in for sure.
So that's really important then for all of you. I can't urge this enough, is that you get your enrollment information back to Jason as soon as possible so that we can do what we need to do on our side.
So we would need that temporary one to even be able to log in on the online app type stuff too?
Yes.
Okay.
Yep.
Is there anything retroactively that if we didn't get that in time that they could still submit it and bill it like normal? And
so pharmacy, if you go to the pharmacy and you have to pay, what they've been known to do sometimes, if you're taking a maintenance med, and they sometimes will split it and just give you like maybe 5 pills and you could have to pay for those. Or if you went ahead and got a 30-day supply, you would get the receipt and then you would have to submit it to Blue Cross for reimbursement if we don't get you active in the system before then.
okay, but we would officially be active. I mean, I've had this issue in the past where I got signed up and I didn't get any of my cards and I was still charged for it because it was still active even though they hadn't processed it yet.
Right. So once we get you active in our system, then it usually takes a day to pass overnight into the pharmacy system. So like I said, we're going to work closely with Lori and Jason to keep everyone updated on the process of how it goes, to get everyone in and get you active. So we'll communicate that with Jason and let him know.
Jeff, you got your hand up?
I don't think I ever put it down.
Oh, okay, good enough. I just saw it was there, and I thought, well, I'll let Jeff know. Okay.
Let's just say I'm stretching. I don't know how to put it down, actually.
Like the kids in class, they sit there and do this, holding the arm.
Any other questions, guys, for Deb, for Lori, for me? Like I said, if you got questions for me, I'm in the office all morning tomorrow, and most of you got my cell phone, or you can get it. So don't hesitate to call me this weekend. I'll talk to you. And then next week, the enrollment forms, we'll get those out to you. Get them filled out. Get your choice made, and we'll get you logged in, uploaded to the system.
Hey,
And
Jason,
for-
quick question, and I don't know that anybody's asked it tonight yet. The information that you put out with what our existing plan is, and you guys said it was going up 20%. Was the coverage still the same on everything there? Just the price was going up, or how did that compare? I guess is my question.
For on the Health Alliance plan that we're currently
Yes.
on,
Yeah.
the everything was going to, the coverage would have been the same, but the increase was going to be
Just in
the 20%. Yeah.
At
The difference,
dollar amount at the bottom, add 20% to that, and that'll get you close to what we were going to be looking at.
yeah, and the reality, I mean, unfortunately, you guys, it's a dollars and cents game. The increase for Paul's was going to be, well over $100,000. That would
Yeah.
be just Paul's portion. Even though it's, you look at it and say, well, it's only 20%. Well, that's a pretty sizable number for the company. So
Yeah, I was just curious if the coverage had changed or not. I assumed it was the same since that's what you put out, but that was just
yeah.
a clarification I had on my part. Oh.
Yep. Yes, sir. Yep. Good question. Any other questions? Like I said, guys, feel free to reach out to me. I'll do my best to get your answer quickly, and we'll get everybody loaded up so that we don't miss a beat.
You said you're mailing out the enrollment forms, right?
I'm going to email the forms to you if you're
Okay.
on email. If you're not, I'll get them in everybody's hands. Yeah. So I'm going to email the form out and ask you to fill it out and bring it back to me, fax it back to me. I'd prefer not to email it because you probably will have some, personal info in there that I don't want over email, but fax or get it back to the shop quickly. That will be great. Any other questions?
Yeah, this is Ben.
Yeah, Ben.
Is this PowerPoint or whatever the slides were there, is that something that can be emailed out?
Yes, I will email out the PowerPoint that Deb had. I will send that out to PMW, so you'll have that. I'll do that here tonight. Not hearing any other questions. I will say thank you. Thanks, Deb, for joining us here at 6 o'clock and answering the questions, and everybody that joined us. Thanks a lot. Again, I'll keep stressing. Got questions? Don't hesitate to call and ask, and we'll get you the answers as quick as we can.
Sounds good. Thank
Thanks,
you guys
everyone.
so much.
Thank you.
Thank you, guys.
Bye.
Thanks. Bye.
Bye now.